Healthcare changes are upon us. Today we'll hear from the insurance industry on how the change may affect the price of your premiums, how hospitals are prepping for the change, and one woman's health battle without insurance. It's time for Money Talks America. Healthcare in America may never be the same. Today we look at the changes and hear from the groups who will make it happen. Hi, I'm Snaith, Director of the Institute for Economic Competitiveness in the College of Business Administration at the University of Central Florida. We're here at the College of Nursing at UCF in front of a not quite live audience. The College of Nursing is among the most widely regarded nursing institutions in the region. It has a strong commitment to clinical excellence and community service. The graduates here will enter into a very different healthcare environment than even the class that preceded them. Without a doubt, one of the most affected groups of people would be those who currently do not have insurance. There are between 46 and 50 million people without insurance across the United States. The three states with the highest numbers of uninsured are California, Texas, and Florida. In the Sunshine State, 1 in every 4 people is without health insurance, and the problem has grown since the recession started. Shepherd's Hope is an organization in Central Florida that provides free medical care for the uninsured. More than 2,000 volunteers work in 9 health centers to see patients just about every night of the week. Of those 2,000 volunteers, more than 700 are licensed healthcare providers. In the past 13 years, those volunteers have conducted more than 100,000 patient visits. Money Talks America correspondent Carrie Farinack introduces us to one of these patients.
Eloisa Martins was living the American dream. She moved here from Brazil 16 years ago, got an apartment and a full-time job.
$13.58, thank you, out of 20.
But a year ago, that dream turned into a nightmare.
I noticed a small lump, under my left breast.
Eloisa works full-time and saved enough money for a mammogram. But without health insurance, she just couldn't afford the surgical biopsy needed to diagnose the tumor. The lump was growing, as was Eloisa's concern. That's when she heard about Shepherd's Hope. Patients like Eloisa who are eligible for services through Shepherd's Hope have an income of at or below 200% of the federal poverty level. They are uninsured and not eligible for government-assisted health care programs. Recently, Eloisa returned to the health center where she was first seen by a doctor.
It's an emotional moment. Yeah, it is.
Eloisa is returning with gratitude. The volunteer doctors sent her to one of Shepherd's Hope's partnering hospitals who donate lab and radiology work. From there, she was sent to a specialist who determined she did have cancer. She now spends her days off in chemotherapy. Even though Eloisa has lost her hair, she is a fighter.
I consider myself a tough person, and when I see my pictures with long hair, I want that hair back again. But in the same time, I think I want to be healthy, no matter what.
The volunteers are helping her do just that. There's the one nurse who saw Eloisa, the one doctor who recognized the tumor, and the one surgeon willing to donate her time to perform a surgical biopsy.
And she was like in that fight with me, trying to find the place to get the biopsy performed and not having any luck. So she said, it's done, I'm gonna do the surgery.
I felt like we needed to know so that we could get things started as far as treatment is concerned.
The day that she performed the surgery on me, that was very emotional. It was an emotional thing because it was the day that she was getting married.
That's right, Florida Hospital's Dr. Jean Fung performed the biopsy the morning she left for her wedding, knowing it just couldn't wait.
I went into medicine because I like to take care of patients and like to try and make them better. And so the Shepherd's Hope allows me to be able to do that.
I needed to do something, I couldn't continue living with that being a huge thing in my breast and not doing anything.
Now, Dr. Fung will remove the tumor and Eloisa's entire breast. Eloisa will likely have to save for years to cover the cost of reconstructive surgery, but she says her life will be different when she's cancer-free.
When I pass this, I'm gonna start a new life. A new life.
Shepherd's Hope volunteers see the challenges of the uninsured firsthand. While healthcare access for the uninsured is a much discussed national priority for many Americans, Shepherd's Hope is offering a faith-based model that can be replicated in local communities across the United States, bringing hope and healing to many in need. For Money Talks America, I'm Carrie Fairneck.
After months of political infighting and likely more to come, Democrats pushed through one of the most comprehensive changes in social programs since Social Security. Joining us now to talk about it is Money Talks America correspondent Ed Highland.
Sean, under the health care legislation, by 2014, all Americans would be required to have health insurance or pay a fine, except for low-income Americans. Employers would be required to provide coverage to their workers or pay a fine of $2,000 per worker. Companies with fewer than 50 employees, however, are exempt from this rule. The law requires plans to cover children until age 26. It also extended the employer-provided health care gross income exclusion to those situations. Medicare patients that hit zero in their prescription drug coverage would receive $250 to help cover the gap. Based on a sliding scale that takes into account the number of employees and the average wages, small businesses with no more than 25 employees and average annual wages up to $50,000 would receive tax credits to help provide insurance to employees. The credit is up to 35% of the employer's contribution if the employer pays 50% of the total cost of coverage. Health plans are barred from denying coverage of pre-existing conditions. Insurance companies can no longer place lifetime caps on coverage for individual policy holders, and it ends rescissions. Insurance companies are prevented from dropping coverage for people after they become ill. And Sean, new private plans are required to completely cover a patient for preventative services with no copayments and no deductibles. Also, there is a 10% tax now on tanning services, so browning up will cost you a little bit in the healthcare end of it all.
Well, I don't know if George Hamilton's going to be enough really to cover the deficits that we're facing and the potential deficits that healthcare might foist upon us.
A serious challenge indeed.
Thanks, Ed. The healthcare legislation will impact all of us, so we wanted to zero in on some of the key players in the original debate and ask how they are preparing for the changes. Up first is Rich Morrison. Rich is the Regional Vice President of Governmental Relations for Florida Hospital. Thanks for joining us, Rich. As it stands now, Rich, a lot of uninsured people end up going to the emergency room for their health care treatment. How much of an impact does that have on Florida Hospital?
Well, the uninsured, obviously, if they're coming to the emergency room for primary care mostly, we are, I hate to sound mercenary about this, but we collect very, very little from the uninsured, and that puts increased cost burdens upon the hospital, which in turn are kind of transferred to the private market. So it increases our costs, reimbursement is not there to compensate for that, and it creates a systematic problem not only for the hospital but for society at large.
Rich, have you been able to digest what the impact of this healthcare legislation might be on treating the uninsured and how that's going to affect Florida Hospital's bottom line?
We're beginning to take a look at that. It's, and the reason I say beginning is because the bill is extremely complicated. You could look at it and assume that all the numbers are right, and in fact, if all the numbers and the projections were right, then our cost would theoretically go down because you're going to have people having better access, less people coming to the emergency room, and more people paying for their health care. So that will result in less of a cost shift to insurance and business. But that assumes that everybody who could get insured does get insured, and that people don't go from being insured and then go over into the new Medicaid eligibility, which is 133% of poverty. So it's going to be very complex. It's possible that our cost versus reimbursement would stabilize and we would have a better picture, but it's also possible that things could get, from a financial standpoint, worse depending on who plays and who stays out of the system.
One big aspect of healthcare reform is preventative care. As it stands now, hospitals treat mainly those that are sick. In the future, will hospitals have to take a greater role in preventative care?
I hope so. Our hospital particularly has been built on a tradition and a history of prevention. And a lot of religious hospitals have had that as an emphasis, but the Adventist health system particularly. We are stepping up and looking at expanding our whole role in prevention. We've started with our own employees. If there's things that we believe and know work, we're going to go do them.
Rich, is healthcare reform going to impact the dynamics of the relationship between the hospital and your doctors and patients?
As it stands now, no. But as this moves forward, there is going to be, I think, significant changes. There have to be significant changes on the whole idea of readmissions. There's provisions in healthcare reform that if you have too many readmissions to your hospital in a certain period of time, let's say 15 days or 30 days, the hospital's not going to get reimbursed. So again, the financial relationships are going to change and the working relationships are going to change, because we both are going to have to focus on this whole issue of continuity of care, transition of care, and both be held accountable for outcomes.
Healthcare reform is going to add 40 to 50 million additional patients to the system. How will you deal with the additional demands for doctors, nurses, and other health professionals?
This is, I think, the biggest challenge and the biggest problem that is left unaddressed on the table. The big issue is going to be who sees these people. So if suddenly I've got all these people who have financial access and could pay for a doctor, but I haven't increased the doctors and I haven't increased the nurses who could be an alternative, either nurse practitioners or others, particularly in a primary care setting, I have not really increased the practical access. So unless that problem's addressed, we may have an illusion about access to care.
Rich, thanks so much for joining us today. You're watching Money Talks America. I'm Sean Snaith and the subject is healthcare. What changes can we expect? Let's hear how the insurance industry is coping. Carl Patton is public policy research and education consultant for Blue Cross Blue Shield of Florida. Carl, thanks for joining us today.
Thank you for having me.
Does Blue Cross Blue Shield of Florida have an official stance on this healthcare reform policy?
Yeah, for a while we've had what we call our vision of healthcare reform, and generally what it is, we do believe in universal coverage. We do think that everyone or nearly everyone should have health insurance, and the question is, how do you get there? We do believe in an individual mandate and an employer mandate. So what an individual mandate says is that everyone who can't afford insurance must purchase it, and employers should be willing to provide it. However, if you cannot afford it, we do believe in subsidies as well. So which is pretty kind of in line with the legislation, with the healthcare reform legislation. However, we do have some differences with that. And then we also believe that there should be a personal responsibility component, meaning that not only if you can purchase it that you should, but also that there should be some personal responsibility to take charge of your own wellness and prevention as well. And then also we believe that the delivery system should focus more on wellness and kind of get away from or stop focusing solely on illness.
Well, you bring up a couple of points I think that are interesting issues. One, how do you enforce a personal responsibility? How do you stop me from eating a bag of Cheetos every evening and watching TV and not exercising?
Well, part of it, and there's been some effort along this way, it's really primarily economic. There's a scheme called value-based insurance design, which some companies have done, some states have done as well. And so basically what you do is you make the individual responsible for doing things to increase their wellness, and if they don't, they pay a higher premium. So in some schemes what happens is that someone, once you enter the coverage, or once you obtain the coverage from the employer or whomever, you pay the same premium as everyone else. However, they identify certain risk factors, and if you do what's prescribed to you to address those risk factors, your premium remains the same. If you don't, premium goes up.
Now, one of the things, as I understand it, in this healthcare reform is a mandate that everybody has to have health insurance.
Correct.
Now, one of the issues that has been brought up is that younger people People that might not have health insurance, might choose not to have health insurance right now because just because of their age, would now be forced to buy health insurance and in some ways subsidize us older folks that are actually going to be using more of that health care. Now, is this, is this going to be possible? I mean, are the penalties sufficient to ensure that young folks are going to do this, or will they be able to game the system? For example, I'm not going to get health care insurance, I'll just pay the fine for now. Whoops, I got sick, I'm going to go buy insurance. They can't reject me because of a pre-existing condition.
Right.
This is great.
Right, correct. We do think that the fines are insufficient at this point. Unfortunately, that is the best way to make access available to everyone, is to have the young support the older, the healthy support the unhealthy. However, in 2014, the fine would be $95. I think the next year it goes up to about $325, and then the year after that to $695. But if you, on an individual policy, you're probably going to pay, even if you're healthy, $1,200, $1,800 a year. And again, as you said, no pre-existing conditions, meaning that I can jump into the system anytime.
Right.
Then I'd rather pay the penalty and then jump in when I'm sick and need the insurance.
So let's move on and talk a little bit about the economics of this. The health insurance industry has been painted sort of as the bad guy in this whole healthcare dilemma in the U.S., much like bankers have been in the financial sector. Are there going to be sufficient resources to suddenly provide tens of millions of additional people with adequate health care? Not
as the system is designed now. I mean, if you look at what happened in Massachusetts, which is sort of a small experiment of this, they had a very low uninsured rate, about 600,000 people, about 10%, and they expanded coverage, and their costs went out of control, much more than what they projected. Really, sound health policy rests on three things: cost, access, and quality. And we feel that access is what's been focused on here in this legislation, but not efficiency and quality. And that's what we need to focus on to make the system more efficient, so that folks are not frozen out of the system because of excessive costs.
So basically, as it stands, the healthcare legislation is just really one leg of this three-legged stool that you've described here. So what if we don't get these other legs in place? I mean, what's going to happen then?
Well, you have two choices. Well, first of all, the cost will go up, and then the decision becomes, well, how much as taxpayers, even as the insured, are we willing to pay? And then what it could lead to is what we call rationing. So that's what happens in Canada, where certain folks who had access to a certain service no longer have access, or they have to wait longer in order to get it. So the money has to come from somewhere, and if the money doesn't come from somewhere, then it doesn't get paid for and it doesn't get done.
I mean, is this being addressed? Because one of the things that was struck me as I read about this healthcare legislation was that insurance companies were no longer to limit the amount of care you get over in a lifetime. And so that means, I guess, I get unlimited care. I can have as much health care as I possibly can consume.
I mean, we spend a lot of money on health care, and just one note, there was a study done in New England Journal of Medicine where everyone only gets what's called evidence-based care 55% of the time. So that means 45% of the time, folks are either getting something that they don't need or not getting what they need, which costs the system money. The quality and efficiency piece is essential in the delivery system. So if we can focus on that, then we can make this work. But if we don't, we'll have unsustainable costs, and which will probably lead to rationing.
Carl, I'm a customer of Blue Cross Blue Shield of Florida. I got a question for you. Are my premiums going to go up? Are my deductibles going to go up? Where are we headed?
And it's hard to say in the short term because there's a lot of regulations that need to be written. I mean, as they put the meat on the bones, we'll really see what will happen in the short term with respect to this legislation and how it guides itself. But again, if we don't address the issue of cost, everyone's premiums are going to go up, or taxes will go up, or they're going to receive less care.
Carl, 100,000 pages is pretty daunting. We'll hope you'll come back and help us sift through all those. Thank you very much for joining us today.
Thank you. Thank you.
Rosen Hotels and Resorts has a unique way of handling health insurance for employees. They provide it on site. The Rosen Associate Medical Center opened in 1991 and has been successful ever since.
Many, many years ago, the coal mining industry had the company store, of course. And they also had a company dock. And hotels actually had hotel docks that took care of not only guests, but employees also. So I said, why can't we create our own little clinic? Listen, We didn't really know what we were doing, to be quite frank, but we hired a doc, a couple of people, and within a very short period of time, and we bought some used equipment, within a very short period of time, we were in business. The beautiful thing about it was that we were essentially controlling our own destiny. And at the end of the year, we were dumbfounded to see how much money we were saving. Not only that, but we created a different kind of relationship with our associates.
You're talking $80 a month, roughly, if that's for pay periods. You can't buy that kind of insurance. We have a $5 copay when we come to the clinic. No one has $5. If you're here for your physical and lab work, there's never a copay for your yearly physical. If I have to come in and get blood work, there's never a fee. I need to go for x-rays, there's never a copayment. So yeah, I mean, cost-wise, you can't beat cost-wise, but it's not always money. You don't always, compare something in money. It's the quality we're getting at the same time.
Actually, I did a plan here through the medical center for weight loss on that, and I lost over 100 pounds on that. And it's the support staff is very good. They're there to work with you, to assist you anywhere that you're needing assistance, from the dietitian to the doctors. If
we were the traditional employer and we went to the traditional route, I suspect we'd be spending $5,000 or $6,000 per covered life. And today we're spending about $25,000 to $3,000. So we'd save $3,000 times $4,500 is around $12 million in terms of savings. And that's a nice savings. It's important. From a business perspective, it's important. We know if we're going to get other employers interested in our paradigm, that has to be more than a touchy-feely kind of situation. And we understand it, appreciate it. I mean, profits are important. They sort of keep you alive. And so we share with them, look, turnover almost evaporates. There's a new relationship that you've created with your associates. They love it. They feel good about working for you. And of course, that then means that they feel good about taking care of the guests that are in the hotel, or manufacturing the widget, or whatever it is. And that's important.
We have healthcare legislation that's coming into effect, starting to unfold for us. How is this facility going to mesh with the existing legislation? Will it work well?
This legislation is fraught with all kinds of crazy things. We now immediately have to cover youngsters up to 26. That's not going to be horrific. But they speak nothing about wellness, nothing about prevention, nothing about costs, nothing about tort reform, nothing about portability. It's insane.
It sounds like the Rosen model is one to pay attention to. The National Federation of Independent Business has joined Florida and 19 other states in its lawsuit challenging the constitutionality of healthcare reform legislation. The suit alleges that the new law infringes on the constitutional rights of Americans by mandating they have healthcare coverage or pay a tax or penalty. I think this lawsuit and what we heard from our guests on today's show point to a single fact. Although the legislation was passed, the debate is far from over. Healthcare is a complex assortment of issues. It's going to take many, many years to sort out. And as Carl pointed out, the final legislation could be in excess of 100,000 pages. This episode of Money Talks America is over, but I think in the future we'll be revisiting this issue of healthcare once again. I'm Sean Snaith. Thanks for joining us.